The topic of today's discussion is about the volume of distribution. In order to make this point clear, we will talk about the fluid in human body. First of all, we must know about the fluids, and if we know about the fluids, then it is very easy for us to understand the topic, that is volume of distribution. So let us get started from the very first point, that is the fluids in the human body. What is actually the fluid in the human body? Simple, the fluid in the human body is actually, by definition, it is the 60% of the body weight. Whatever is the weight of your body, the 60% of that weight is actually the body fluid. Means fluid is actually composing the 60% of your entire weight. Suppose here I got a body that is having 70 kg. The weight of the body is 70 kg. Now a question is asked to me, what is the body fluid now of this person? I will just simply take this person's weight. What will I do? I will take the percentage of this because in the definition we are told that 60% of the weight is actually the body fluid. Now I am finding the body fluid, so 60% of the weight, that is 70, is what? 0.00006742. So I got the answer 42. In short, 42 liters are actually the fluid. It is actually the fluid concentration of this particular individual who is having 70 kg weight. Now out of this 42%, 42 liters weight of the liter, 42 liter of this fluid, there is further division of this 42 liter. This fluid is actually then distributed into further three portions. The very first portion is that is intracellular. The very biggest portion of this, that is 28 liters, will reside in the cell intracellularly, and then outside the cell there is further the remaining fluid distribution. How? Like, very simple. Here we got the cell, so inside the cell we have the fluid, then surrounding the cells again we have the fluid. And well, if we talk about the humans, we will be having cells, and between the cells there will be the space, and along with that there will be the blood vessels. So now what will happen? This fluid will distribute itself into the space between the cells, known as interstitium, inside the cell and inside the blood vessel, called as intravascular fluid. So out of all these, what will happen then? This 42 liter fluid will distribute into the cell, interstitium, intravascular. The biggest portion is in the cell, 28 liters. Interstitium, here the portion that will reach will be the 10 liters, and remaining 4 liters will reside in the blood vessel, intravascular. This is actually called as plasma. Plasma comprises 4 liter, or one can say 4% of the body weight is plasma, 10% of the body weight is actually interstitium fluid, okay, and 28% is actually in the intracellular, means inside the cell. Well, I talk about a percentage, and you can also talk about the liters. So in short, fluid in the human body is 60% of the body weight. Whatever is the weight of the person, 60% of the weight is actually the fluid. Now 70 kg is the weight of the person, and if I just take the percentage, 60% of this 70 is actually 42. So in this individual, 42 liters will be fluid, and the remaining is the weight. Well, 42 liter, out of this 42 liters, 28 liters will reside in the cell, or it is actually the fluid that is present in the cell, and 10 liters are actually 10 liter is actually the fluid on interstitium, and the remaining 4 liter is actually the fluid in the intravascular. Now just sum up: 28 plus 14, 8, 9, 10, 11, 12, 42. So this is the entire amount, concentration of the fluid inside the cell and outside the cell. If we talk about outside the cell, extracellularly, we are actually talking about the interstitium and intravascular portions. So this is how the fluid is distributed in the body. How to find the fluid and how the fluid is distributed. We got two questions: how to find the fluid in the human body, how the fluid is distributed. Now a question rises when we are discussing the pharmacology with the friends, with students: what is actually the volume of the distribution, or what is the apparent volume of distribution? Somewhere you may be asked about this, like this: what is apparent volume of distribution? Why? Because, well, we'll tell you people about the word apparent at the end. First, let's know what is actually the volume of distribution. Simple. Volume of distribution is when you give a drug to the body, to the patient, when you give the amount of the drug that you're giving, drug in the body that is actually injected, and drug in the plasma, when these two are actually taken in a sense of ratio. In short, volume of distribution is actually the ratio of the drug in the body and drug in the plasma. Here I took the drug, I injected it, and I got the concentration in the plasma, interstitium and cells. How will I know whether my drug has reached the particular portion or not, or how much my drug has diffused into the body that I have given to the patient? I gave a drug to the patient. Now how will I know that the drug that I have given to the patient has reached what compartment of the body, or has reached what portion of the body? Means whether the drug is in the plasma, in the interstitium, or in the cells. So how will I know this? In order to get the answer of this question, where is my drug now in the body, we will go through this formula, volume of distribution. So this is actually a kind helping us to get the answer that where my drug has actually diffused that I've given to my patients. Well, what will happen? Guess what? We got a drug that is having, we're going to find the volume of distribution of that drug. We got a drug that has got a concentration of the 100 mg. What will happen? The drug reaching the plasma will be 20 mg out of 100. What will happen now? Simple. mg 0025. Now what is the volume of distribution? That is 5 liter. Now via this formula we got this answer, that the volume of distribution is 5 liter. Now what does it mean? It means that my drug is actually distributed in the 5 liter of the body fluid. Now what will I guess from this answer? Simple. This means that out of the 42 liters that is actually the body fluid, 5 liters have been covered. It means that the 5 liter is actually about a plasma. That is 4 liters is actually the fluid concentration that is in the plasma, and 10 is in the interstitium, and remaining 28 is in the intracellularly. So now if I get the answer from this formula, what I'm doing, I gave a drug to the patient. Well, the very first thing, I gave a drug to the patient, and then I just took the sample from the plasma. I gave a drug to the patient was 100 mg. The sample that I took was 20 mg. I just took the ratio of these two. What I got, 5 liter. Now this answer is telling me how much a drug is actually diffused and where it has been to. So according to this formula, according to this answer, this means that my drug is actually the maximum portion, the 99% of the drug is actually in the plasma, and the remaining a little bit is actually in the interstitium. What if the volume of distribution, what will be the volume of distribution if out of this 100 mg, 10 mg is actually in the plasma? I gave a patient a drug, 100 mg. 10 mg is in the plasma. 10 mg is in the plasma when I took the sample of the plasma. So what is this now telling to us? Very simple. Just solve this ratio, you will get 10. Now VD is actually 10. Volume of distribution is actually 10, or means 10 liters. Now what does this mean? Simple. Where is 10? Here, 4 and 10. It means that the drug is actually having its path. It has been distributed from the plasma to the interstitium. Now it is in the interstitium. Why? Because the value is larger. The more it is going higher, the more it is telling us about the distribution of the drug. So this is actually formula that is actually helping us that how much the volume of the body is actually being covered by the drug, or where the drug has been diffused. So how much the drug is diffused is actually being told to us by this formula, or we get the distribution of the volume via this formula, distribution of the drug via this formula. So we use this formula to calculate the volume of the distribution of the drug. So this is how we go through the volume of distribution of the drug, and this is called as apparent volume. Why? Because the reason behind is very simple. Now this is not going to be working all the way long. Why? Sometimes there are some drugs that are having the volume way much than this result. Suppose if we take the 100, and out of 100 if you take the sample and you get in the sample a very big concentration, the concentration is supposed to be like 2 means small concentration is actually achieved when you inject into the patient a drug and you get 2 mg only. Out of 100, you get 2. What does it mean now? It means when you divide it to 550, now it is giving us the result that is 50 mg. Now, what does this mean? Where is 50 with us? So it means that the drug has been diffused thoroughly into the interstitium and cells, and well, sometimes you will get there is a drug, and there are drugs that are having the volume of distribution when we calculate their answer is actually exceeding than thousands of liters, Here we're getting 50 liter answer. So now in the entire body we have 42 liters. Now from where to bring the 50 liter? So this is actually a formula that is telling us how much the drug is diffused from the entire drug that is given. So it is actually a kind of apparent volume. It is not the true volume. Simply, it is actually helping us only to understand or to get or to guess about the drug position right now. Where is actually the drug? Where is actually the drug? So in short, it is actually telling us about the distribution of the drug. In short, okay. For more, you can comment us in the comment box, and that's it all. Thank you for watching.